Hello, my name is Amaia Muñoz and I am a neurologist in Barcelona, Spain. I work under the leadership of Professor Dalmau. I am especially involved in the field of sleep disorders in autoimmune encephalitis. Thanks to the AEA Community Seed Grant that we received in 2021 for the project Subclinical Activity in anti-LGA1 encephalitis, diagnostic test and prognostic implications, we have been able to study the post-acute stage of up to 25 patients with anti-LGA1 encephalitis that we have followed for a whole year, and it is a pleasure to offer you a brief update. You may know that anti-LGA1 encephalitis most times presents as a limbic encephalitis, which means memory problems, behavioral and mood alterations, different types of epileptic seizures, some more specific seizures named facial-brachial dystonic seizures. Many of these patients also complained of insomnia, which in some cases may be severe, even precede the onset of other symptoms. For our study, patients from different centers in Spain came to our hospital after the disease had been diagnosed and treated with adequate immunotherapy, and most of them reported to have a substantial improvement with respect to the pre-diagnosis stage of the disease. When we received them, besides carrying out a complete and thorough interview and neurological examination, all patients spent one night in the sleep lab to study sleep alterations and nocturnal electroencephalography. And now I will explain the three findings that I consider may have the most direct impact for patients. First, we have found either epileptic seizures or facial-brachial dystonic seizures or both in more than half of the patients during the night, between 3 and more than 20 episodes in one night. But what makes the finding important is that only a minority of the patients were aware of the seizures, and most of them were going unnoticed for the patients, for the families, for their neurologists, mainly because they have very subtle symptoms, but they are occurring once and again over one night. Second, we saw that about 75% of the patients had a low sleep quality, meaning that they had many or very long awakenings during the night and often did not reach the deepest repairing stages of sleep. And third, during the follow-up, we saw that intensifying the immunotherapy was effective to make seizures disappear and correct sleep problems in most of the patients, what means that probably these symptoms are not disease sequelae, but markers of disease activity that needs to be halted. And it is just a hypothesis, but persistent seizures and bad sleep quality may be contributing to a slower or incomplete recovery of cognitive or memory functions in patients with anti-LGA1 encephalitis, and detecting and treating them promptly with rather easy tests like a sleep and EEG study may improve the prognosis of these patients. So thank you so much for your support and for your contribution to our study.